Glucose tests. You should be tested to determine if your blood glucose level is within a healthy range, to screen for and diagnose diabetes and prediabetes, and to monitor for high or low blood glucose, and to check for glucose in your urine. You should get tested when you are older than 45 years or have risk factors for diabetes, when you have symptoms suggesting high or low blood glucose, and during pregnancy. The sample required may be a blood sample drawn from a vein in your arm or a drop of blood from a skin prick. Sometimes a random urine sample is used. It is recommended that you fast for at least 8 hours before having a blood glucose test. For people with diabetes, glucose levels are often checked both while fasting and after meals. Glucose is the primary energy source for the body cells and the only energy source for the brain and nervous system. A steady supply must be available for use, and a relatively constant level of glucose must be maintained in the blood. During digestion, fruits, vegetables, breads, and other dietary sources of carbohydrates are broken down into glucose. It is absorbed by the small intestine and circulated throughout the body. Using glucose for energy production depends on insulin, a hormone produced by the pancreas. Insulin facilitates transport of glucose into the body cells and directs the liver to store excess energy as glycogen for short-term storage and/or as triglycerides in adipose fat cells. If there was a problem in insulin production, as in diabetics, that may disrupt the balance between glucose and the pancreatic hormones, resulting in high or low blood glucose. Severe and acute changes in blood glucose, either high or low, can be life-threatening, causing organ failure, brain damage, coma, and, in extreme cases, death. Diabetics must monitor their own blood glucose levels, often several times a day. Several health organizations recommend diabetes screening when a person is age 45 or older, or when a person of any age has risk factors as overweight, or physically inactive, or a first-degree close relative with diabetes, or a woman who delivered a baby weighing more than 4.5 kilograms, or with a history of gestational diabetes, or a woman with polycystic ovarian syndrome, or high blood pressure or high cholesterol level, or having a history of cardiovascular disease. These tests may also be ordered when someone has signs and symptoms of high blood glucose, such as increased thirst with frequent urination, fatigue, blurred vision, and slow healing wounds or infections, or having symptoms of low blood glucose, such as sweating, hunger, anxiety, confusion, and blurred vision. Pregnant women are usually screened for gestational diabetes between their 24th and 28th week of pregnancy.
مختبرات البرج الطبية. شاهد المزيد على قناتنا على اليوتيوب.